Good morning, everyone. On behalf of Baltimore Mayor Stephanie Rawlings Blake, I wish to thank Dean Clagg, Associate Dean Sharfstein, and the Bloomberg School of Public Health for hosting this outstanding symposium today. And I also want to thank Congressman Waxman and our many doctors and scientists who have spoken today for your leadership and for working every day to advance science so that we can protect our public. We stand here as pediatricians and public health leaders of Baltimore City and County to express our solidarity on the importance of childhood vaccination. Let me take us back to the 1930s. There was a measles outbreak right here in Baltimore, right here where we're sitting, that sickened thousands of our children, that killed or permanently injured hundreds in our city. Families lived with uncertainty and fear, not knowing when illness and tragedy would strike us. Thanks to the invention of vaccines, as we heard today, we're fortunate to live in an era where many of us have never seen the devastation of diseases like measles. For the last 10 years, we have had 0 cases of measles in Baltimore. That means 0 deaths, 0 injuries, 0 hurt children, 0 tragic families. We have come so far, only to see measles take hold again. If it's a lesson from everyone today, it's that we cannot be complacent. As individual doctors, we have been advising our patients to make sure that children are vaccinated. Today, our region's doctors have come together to make a joint statement. The Baltimore Statement on Childhood Vaccinations is our united stand against measles. Johns Hopkins, the University of Maryland, St. Joseph Medical Center, Mercy Medical Center, Sinai Hospital, Harbor Hospital, St. Agnes Hospital, Greater Baltimore Medical Center, and MedStar Franklin Square. These are the institutions with their leading pediatricians standing with the health departments of Baltimore City and Baltimore County and the Maryland chapter of the American Academy of Pediatrics. Ours is an unequivocal message. Vaccines are safe, they're effective, and they save lives every single day. When we as individual doctors speak with our patients about vaccines, it's about the one-to-one relationship and improving that individual's health. When we as the region's doctors speak to the public about vaccines, it's about more than the individual's health. It's about the health of our community. It's about our mutual obligation to one another. It's about the value of vaccines to safeguard the future of Baltimore. I'd like to now introduce 2 of our area's distinguished pediatricians to explain why they have signed on to the Baltimore Statement on Childhood Vaccinations. First is Dr. Stephen Zinn, the Chairman of Pediatrics at the University of Maryland School of Medicine. Dr. Zinn.
Well, thank you, and I want to really thank Dr. Wen for bringing this whole group together today for such an important issue. I am a pediatrician, but I'm also a parent of 4 beautiful children. As parents, we have an obligation, we have a responsibility to keep our children out of harm's way. And so I'd like to address my comments to the parents who have not vaccinated their children or who are thinking about not vaccinating their children against measles. I ask you to contact your healthcare providers today. I ask you to objectively review the information with your healthcare provider. The oft-cited study that suggests that there are complications to the measles vaccine and potentially cause autism was so flawed and so misrepresented the data that the journal that published it had to take the unusual step of publicly retracting that paper. I ask you to review the data. There have been dozens of studies in the last 10 years that demonstrate the safety and efficacy of these vaccines. If you do that, common sense will dictate that you need to get your children vaccinated. You need to get your children immunized. You need to keep your children out of harm's way. Vaccinating your children will not only protect them from measles, but it will also protect the other children in your community who are either too young to be vaccinated or have other medical conditions that don't allow them to be vaccinated. It's the right thing to do, and the data supports it. Thank you.
Thank you, Dr. Zinn. And now we have Dr. Joseph Wiley, the Chief of Pediatrics at Sinai Hospital.
Thank you, Dr. Wen, and I appreciate all of the comments that have happened before I got here. Especially delighted to see my good colleague and friend, Dr. Sharfstein, who worked for Congressman Waxman. I am a pediatric physician, but I'm also a pediatric oncologist. That means that I take care of children who are vulnerable because of their condition and the therapy that we give them, perhaps among the most vulnerable that we care for. They have a lot to go through in terms of dealing with their illness. I don't want them to have the fear that because of their illness, they're going to be at risk for contracting an illness that is vaccine preventable. As has been so eloquently said by our friend in politics, vaccines have made the biggest difference in the history of the planet in terms of illness, right there next to hygiene and other things. We have an obligation to protect our children, as Dr. Zinn has so well said. I haven't missed a day of work from illness in 31 years, but the sickest I ever was in my life was when I was 5 years old and I had measles. I would never want to see anyone go through that. We have the ability to prevent that from happening in the future to our children. I think that we all have an obligation to help each other understand the right path forward. And rather than take stands against each other, we need to walk forward to make sure that this is one of many issues that we address now and forever for our children and for our society. So thank you, Dr. Wen, for bringing us here together.
Thank you, Dr. Wiley. I express my gratitude on behalf of Baltimore Mayor Stephanie Rawlings-Blake and the Baltimore City Health Department. We are honored to bring together our region's pediatricians and public health leaders to take a stand against measles. We in Baltimore don't want to wait until it's too late. We do not take a back seat to public health. We educate to improve health. We tackle myths and misinformation. We lead with science and evidence. We urge health leaders in every city across the U.S. to join Baltimore to prevent measles from rising again. Thank you.